Turning now to the pandemic, California is the first state to officially declare an end to years of mandates. The state's working on a long-term plan now detailing how to live with COVID. It includes mask mandates during future surges, regional testing of wastewater, and better access to COVID treatments. The World Health Organization says it's monitoring 3 new subvariants of Omicron. This as the CDC prepares to update its guidance on masks as early as next week. So let's bring in Dr. David Winter from Baylor Scott & White Health to dig a little deeper into sort of where we stand in this pandemic right now. Good to see you, Dr. Winter. I want to start with mask mandates. In all states except for Hawaii, they're being relaxed. So does this coincide with the prevalence of COVID cases in America?
Well, it does. The good news is we've been watching now for some time, several weeks anyway, total new case of COVID going down, hospitalized patients with COVID, that's going down, and finally daily death rates are going down. So it is declining. However, there's still plenty of coronavirus out there. The total daily deaths are still around 2,000. And let me emphasize this. I've got a chart here that shows that if you've been vaccinated, first, let me just point out, it's not that many deaths. So less than 8 out of 100,000 in the unvaccinated folks, that's a low number, but it's still 8 deaths at least every day we're worried about. And then you look at the folks that are vaccinated, much less than 1%. And to emphasize how boosters work, it's 0.1 per 100,000. So clearly the vaccines make a difference. Now, should you do that or not? You know, for me, some people drive in a blizzard, some people skydive, some folks don't even get a flu shot. So it's all about risk avoidance. Take your chances in what you want to do with the masks, Sonia.
Yeah, and there's we saw the chart there that you mentioned for a second. You know, I'm wondering, Dr. Winter, what your thoughts are on relaxing masks when you're, out in public. I know there's a lot of events happening. The weather's cold outside, so we are gathering indoors to eat and do other things as it relates to this stealth Omicron variant. So what do we do with the masks and where do we stand with this stealth variant?
Yeah, well, there's some new news about the stealth variant that just came out of Japan. This is a little bit concerning. They found that, we know it's more contagious, but they found that it looks like it may cause more serious illness and more deaths in hamsters, in animals, not in humans, no human studies yet. So how bad it's going to be, we don't know, but that virus is actually increasing. It's about 20% around the world. It's less than 3% in America, but we're not measuring that in every single case, and they call it the stealth virus because if you measure for the variants, Alpha, Delta, and Omicron, you can't tell in the routine testing between that and the new one, the BA2, the stealth virus. That's why they call it stealth. So know that it's out there. If you wear a mask, you're more protected. In high-risk areas, I recommend it. Low-risk areas, take your chances.
All right, Dr. David Winter, as always, thank you so much for your time and your insight today.